17. The 8 questions. Lia did not die. Nor did she recover. Foua often dreamed that her daughter could walk and talk. But when she awoke, Lia lay curled next to her in bed. A slight, silent husk who hardly seemed big enough to contain her family's load of memory, anger, confusion, and grief. She lay suspended in time, growing only a few inches, gaining little weight, always looking far younger than her age, while the Lee siblings who still lived at home, 6 athletic, bilingual children who moved with ease between the Hmong and the American worlds, grew up around her. Cheng joined the Marine Reserves and was called to serve in the Gulf War, but to Foua's nearly hysterical relief, the war ended 2 days before his scheduled flight to Saudi Arabia. May went to Fresno State University, majoring in health science, a choice influenced by her childhood experiences, both positive and negative, as the ad hoc arbitrator between her parents and the medical establishment. Yer, a volleyball star who had won the award for Best Girl Athlete at Merced High School, joined May at Fresno State 2 years later, majoring in physical education. True became Merced High's student body treasurer and president of its youth culture club, among social and service organization with more than 200 members. Mai became a standout soccer player and was known as one of the most beautiful teenagers in Merced, a reputation that caused boys to fight over her and girls all too frequently to resent her. Pang grew from a harum-scarum toddler into a self-possessed schoolgirl with a flair for traditional Hmong dance. There were a few tremors as the Lee children passed through adolescence, but never the rifts that American families accept almost as a matter of course. My parents are the coolest parents in the world. True once wrote me, "We don't have everything in the world, but we do have the closeness of us 8 sisters, 1 brother, and our parents. This is the coolest family ever and I would never trade it for anything else in this world." Now qaug gained weight and was troubled by high blood pressure. Foua felt tired much of the time. Seeing that their energies were waning, Janine Hilt urged the Lees to let Lia return to the Shelby Center for special education each day. Not to educate her, that was a thing of the past, but to give her parents a few hours respite each day. Because of their persistent fear that Lia might be stolen from them again by the government, the Lees were reluctant at first, but because they trusted Janine, they eventually agreed. D. Corda, one of whose foster children was severely retarded and also attended Shelby, frequently saw Lia there, lying on her back with her hands strapped to blocks in order to prevent her fingers from stiffening into claws. She could hardly bear to look. The Cordas had all taken Lia's neurological catastrophe hard. The entire family had gone through therapy at the Merced County Mental Health Department in order to deal with what D called Lia being dead but alive. At their counselor's suggestion, the children, biological, foster, and adopted, drew pictures on butcher paper. Wendy drew a mom and a baby, because Lia was with her mom, said D. Julie drew a rainbow with clouds and birds, because Lia didn't have to cry anymore. Maria is real withdrawn, but when we told her about Lia she cried. Lia got through to her. She drew a broken heart with a jagged fence and an eye looking in from the outside. The heart was the sadness. The fence was the wall that Lia had gotten over by touching our lives. The eye was my eye, watching the sadness, with a tear that cried. In 1993, while she was vacationing at Disneyland, Janine Hilt had an acute asthma attack, went into respiratory failure, and suffered oxygen deprivation so severe that she lost all brain function. In other words, she developed hypoxic ischemic encephalopathy, exactly the same fate that had befallen Lia. She died 3 days later with her partner of 18 years, Karen Marino, at her side. When I heard Jenny was dead, my heart broke. Foua told me. I cried because Jenny had told me she wasn't going to get married and she would never have any children of her own, so she would help me raise my children. But she died, so she couldn't do that, and I felt I had lost my American daughter. Neil Ernst won the MCMC residency program's first Faculty Teacher of the Year award. Peggy Philp became Merced's county health officer, a post her father had held more than 40 years earlier. They continued to share their pediatric practice as well as housework and childcare, scrupulously negotiating what one of their Christmas letters described as a blur of laundry, lunches, cleaning, patient care, newborn resuscitation, and resident teaching. Their understanding of the Lees, and the Lees' understanding of them, deepened significantly when they, too, experienced a child's grave illness during his last month of third grade. Their elder son, Toby, was diagnosed with acute lymphocytic leukemia. When Neil tried to tell Dan Murphy about the diagnosis, he cried so hard he couldn't talk. After one of Leah's checkups, Neil wrote me, "Mrs. Lee had heard that our son had leukemia. It was truly amazing how quickly she heard of this. When Peggy saw Leah in our clinic, Mrs. Lee was very concerned about Toby's health, how he was doing, etc. There was very genuine concern expressed by her questions and facial expression. At the end of the visit, Mrs. Lee was hugging Peggy and they were both shedding a few tears. Sorrows of motherhood cut through all cultural barriers. Toby underwent 3 years of chemotherapy and achieved what seems to be a permanent remission. Leah's mother continues to occupy a special place in our thoughts," wrote Neil in a later letter. "She always asks about Toby. Our contacts with her are very infrequent because her family provides excellent care for Leah, but they are special nonetheless. Since Leah's brain death, whatever scant trust Foua and now qaug had once had in American medicine had shrunk almost to zero. I say almost because Foua exempted Neil and Peggy when their daughter May broke her arm, and the doctors in the MCMC emergency room told them it needed a cast. Now qaug marched her straight home, bathed her arm in herbs, and wrapped it in a poultice for a week. May's arm regained its full strength when a pot of boiling oil fell from the electric stove onto Foua's skirt, setting it on fire and burning her right hip and leg. She sacrificed 2 chickens and a pig. When Foua got pregnant with her 16th child and had an early miscarriage, she did nothing. When she got pregnant with her 17th child and had a complicated miscarriage in her 4th month, now qaug waited for 3 days until she started to hemorrhage and fell unconscious to the living room floor. Before he called an ambulance, he consented to her dilation and curettage only after strenuous, in fact, desperate, persuasion by the MCMC resident on obstetric rotation. Now qaug also sacrificed a pig while Foua was in the hospital and a second pig after she returned home. Before she was readmitted to Shelby, Leah was routinely vaccinated against diphtheria, pertussis, and tetanus. At about the same time, she started to develop occasional seizure-like twitches, because they were brief, infrequent, and benign, and also, perhaps, because he had learned from bitter experience, Neil decided not to prescribe anticonvulsants. Foua and now qaug were certain that the shots had caused the twitches, and they told Neil that they did not want Leah to be immunized ever again, for anything. Dan Murphy, who became the director of MCMC's Family Practice Residency Program, once told me that when you fail one Hmong patient, you fail the whole community. I could see that this was true. Who knew how many Hmong families were giving the hospital a wide berth because they didn't want their children to end up like the second youngest Lee daughter? Everyone in Merced's Lee and Yang clans knew what had happened to Leah, those bad doctors. Just as everyone on the pediatric floor at MCMC knew what had happened to Leah, those bad parents. Leah's case had confirmed the Hmong community's worst prejudices about the medical profession and the medical community's worst prejudices about the Hmong. At the family practice clinic, the staff continued to marvel at the quality of care the Lees provided to their clean, sweet-smelling, well-groomed child, but at the hospital next door, where the nurses had had no contact with Leah since 1986, the case metastasized into a mass of complaints that grew angrier with each passing year. Why had the Lees been so ungrateful for their daughter's free medical care? Neil, who did not share the nurses' resentment, once calculated that, over the years, Leah had cost the United States government about $250,000, not counting the salaries of her doctors, nurses, and social workers. Why had the Lees always insisted on doing everything their way? Why, this was still the worst sin, had the Lees been non-compliant. As Sharon Yates, a nurse's aide, told me, if only the parents had given Leah the medicine, she wouldn't be like this. I bet when she came back from that foster home, they just didn't give her any medicine. But I knew that when she returned from foster care, Foua and now qaug had given Leah her medicine for CCS of Depakine 3 times a day, exactly as prescribed, hoping to clear up some questions about Leah's anticonvulsants. I went to Fresno to talk with Terry Hutchison, the pediatric neurologist who had overseen her care at Valley Children's Hospital. I had noticed that in one of his discharge notes, written 9 months before her neurological crisis, he had described Leah as a very pretty Hmong child and her parents as very interested and very good with Leah. I had never seen phrases like that in her MCMC chart. Bill Selvage had told me that Dr. Hutchison was a known eccentric, beloved by his residents for his empathy but dreaded for his insistence on doing rounds at 4:00 a.m. He had an exiguous crew cut and on the day I met him was wearing a necktie decorated with a large bright yellow giraffe. A sign in the hall outside his office, hung at toddler eye level, read, "Kids Zone. Enter with care and love." When I asked him about the relationship between Leah's medications and her final seizure, he said, "Medications probably had nothing to do with it." Huh, I said. Leah's brain was destroyed by septic shock, which was caused by the Pseudomonas aeruginosa bacillus in her blood. I don't know how Leah got it and I will never know. What I do know is that the septic shock caused the seizures, not the other way around. The fact that she had a pre-existing seizure disorder probably made the status epilepticus worse or easier to start or whatever. But the seizures were incidental and not important. If Leah had not had seizures, she would have presented in a coma and shock, and the outcome would probably have been the same, except that her problem might have been more easily recognized. It was too late by the time she got to Valley Children's. It was probably too late by the time she got to MCMC. Did her parents' past non-compliance have anything to do with it? Absolutely nothing. The only influence that medications could have had is that the depakine we prescribed might have compromised her immune system and made her more susceptible to the Pseudomonas. Depakine occasionally causes a drop in white blood cells that can hamper the body's ability to fight infection. I still believe depakine was the drug of choice, and I would prescribe it again, but in fact, if the family was giving her the depakine as instructed, it is conceivable that by following our instructions, they set her up for septic shock. Leah's parents think that the problem was caused by too much medicine. Well, said Dr. Hutchison, that may not be too far from the truth. I stared at him. Go back to Merced, he said, and tell all those people at MCMC that the family didn't do this to the kid. We did. Driving back to Merced, I was in a state of shock myself. I had known about Leah's sepsis, but I had always assumed that her seizure disorder had been the root of the problem. The Lees were right after all. I thought, Leah's medicine did make her sick. That night I told Neil and Peggy what Dr. Hutchison had said. As usual, their desire to ferret out the truth outweighed their desire, if indeed they had one, to defend their reputation for infallibility. They immediately asked for my photocopy of Leah's medical chart, and they sat together on Bill Selvage's sofa, combing Volume 5 for evidence, overlooked during the crisis, that Leah might already have been septic at MCMC, murmuring to each other in their shared secret language, calcium 3, 2, platelets 29,000, hemoglobin 8, 4, they might have been, in fact, were a pair of lovers exchanging a set of emotionally charged intimacies. I always thought Leah got septic down at Children's when they put all those invasive lines in, said Peggy, but maybe not. There are some signs here. I did too, said Neil. If I'd thought she was septic here at MCMC, I would have done a lumbar puncture. I didn't start her on antibiotics because every single time Leah had come in before that, she was not septic. Every other time. The problem was her seizure disorder, and this was obviously the worst seizure of her life. I stabilized her. I arranged for her transport, and then I went home before all the lab results were back. He didn't sound defensive. He sounded curious. After Neil and Peggy went home, I asked Bill Selvage whether he thought Neil had made a mistake in not recognizing and treating Leah's sepsis, even though Dr. Hutchison believed that her fate was probably sealed before she arrived in the MCMC emergency room, and even though the increasing severity of her epilepsy might eventually have led to serious brain damage if sepsis had never entered the picture. Neil leaves no stone unturned, said Bill. If Neil made a mistake, it's because every physician makes mistakes. If it had been a brand new kid walking off the street, I guarantee you Neil would have done a septic workup and he would have caught it. But this was Leah. No one at MCMC would have noticed anything but her seizures. Leah was her seizures. To MCMC's residents, Leah continued to be her seizures, the memory of those terrifying nights in the emergency room that had taught them how to intubate or start IVs or perform venous cutdowns. They always spoke of Leah in the past tense. In fact, Neil and Peggy themselves frequently referred to Leah's demise, or what may have killed Leah, or the reason Leah died. Dr. Hutchison did the same thing. He had asked me, was Leah with the foster parents when she died? And although I reminded him that Leah was alive, 5 minutes later he said, non-compliance had nothing to do with her death. It wasn't just absent-mindedness. It was an admission of defeat. Leah was dead to her physicians, in a way. For example, that she was never dead to her social workers, because medicine had once made extravagant claims on her behalf and had had to renounce them. Once I asked Neil if he wished he had done anything differently. He answered as I expected, focusing not on his relationship with the Lees but on his choice of medication. I wish we'd used Depakine sooner, he said. I wish I'd accepted that it would be easier for the family to comply with one medicine instead of 3, even if 3 seemed medically optimal. Then I asked, do you wish you had never met Leah? Oh, no, no, no. His vehemence surprised me. Once I might have said yes, but not in retrospect. Leah taught me that when there is a very dense cultural barrier, you do the best you can. And if something happens despite that, you have to be satisfied with little successes instead of total successes. You have to give up total control. That is very hard for me, but I do try. I think Leah made me into a less rigid person. The next time I saw Foua, I asked her whether she had learned anything from what had happened. No, she said. I haven't learned. I just feel confused. She was feeding Leah at the time, making baby noises as she spooned pureed zob, the spinach-like green she grew in the parking lot, into the slack mouth. I don't understand how the doctors can say she is going to be like this for the rest of her life. And yet they can't fix her. How can they know the future but not know how to change it? I don't understand that. Well, what do you think Leah's future will hold? I asked. I don't know these things, said Foua. I am not a doctor. I am not a tsiv neeb. But maybe Leah will stay hurt like this. And that makes me cry about what will happen. I gave birth to Leah, so I will always take care of her with all my heart. But when her father and I pass away, who will take care of Leah? Leah's sisters do love her. But even though they love her, maybe they will not be able to take care of her. Maybe they will need to study too hard and work too hard. I am crying to think that they are just going to give Leah away to the Americans. Foua wept soundlessly. Mei Ying embraced her and stroked her hair. I know where the Americans put children like Leah, she continued. I saw a place like that in Fresno where they took Leah once. A long time ago. Foua was recalling a chronic care facility for retarded and disabled children where Leah had been temporarily placed before her year in foster care, while her medications were monitored and stabilized. It was like a house for the dead. The children were so poor and so sad that they just cried. They cried all over. One child had a big head and a really small body. Other children had legs that were all dried up and they just fell on the floor. I have seen this. If the Americans take Leah there, she will want to die. But instead she will suffer. Foua brushed her tears from her cheeks with the back of her hand, in a quick, brusque gesture. Then she wiped Leah's mouth, far more gently, and slowly started to rock her. I am very sad, she said. And I think a lot that if we were still in Laos and not in the United States, maybe Leah would never be like this. The doctors are very, very knowledgeable. You're high doctors. You're best doctors. But maybe they made a mistake by giving her the wrong medicine and they made her hurt like this. If it was a dab that made Leah sick like this in Laos, we would know how to go to the forest and get herbs to fix her and maybe she could be able to speak. But this happened here in the United States. And Americans have done this to her. And our medicine cannot fix that. It was also true that if the Lees were still in Laos, Leah would probably have died before she was out of her infancy, from a prolonged bout of untreated status epilepticus. American medicine had both preserved her life and compromised it. I was unsure which had hurt her family more. Since that night with Foua, I have replayed the story over and over again, wondering if anything could have made it turn out differently. Despite Dr. Hutchison's revisionist emendation of the final chapter, No one could deny that if the Lees had given Leah her anticonvulsants from the beginning, she might still be having, something approaching a normal life. What was not clear was who, if anyone, should be held accountable. What if Neil had prescribed Depakine earlier? What if, instead of placing Leah in foster care, he had arranged for a visiting nurse to administer her medications? What if he had sought out Blaya Yaumua or Jonas Vangai or another Hmong leader who straddled both cultures, and had asked him to intervene with the Lees, thus transferring the issue of compliance to a less suspect source? What if MCMC had had better interpreters? When I presented my what if list to Dan Murphy one day in the MCMC cafeteria, he was less interested in the Depakine than in the interpreters. However, he believed that the gulf between the Lees and their doctors was unbridgeable, and that nothing could have been done to change the outcome. Until I met Leah, he said. I thought if you had a problem you could always settle it if you just sat and talked long enough. But we could have talked to the Lees until we were blue in the face. We could have sent the Lees to medical school with the world's greatest translator, and they would still think their way was right and ours was wrong. Dan slowly stirred his lukewarm cocoa. He had been on all-night call. Leah's case ended my idealistic way of looking at the world. Was the gulf unbridgeable? I kept returning, obsessively, to the Lees' earliest encounters with MCMC during Leah's infancy, when no interpreters were present and her epilepsy was misdiagnosed as pneumonia. Instead of practicing veterinary medicine, what if the residents in the emergency room had managed to elicit the Lees' trust at the outset, or at least managed not to crush it, by finding out what they believed, feared, and hoped? Janine Hilt had asked them for their version of the story, but no doctor ever had. Martin Kilgore had tried, but by then it was years too late. Of course, the Lees' perspective might have been as unfathomable to the doctors as the doctor's perspective was to the Lees. Hmong culture, as Blaya Yaumua observed to me, is not Cartesian. Nothing could be more Cartesian than Western medicine. Trying to understand Leah and her family by reading her medical chart, something I spent hundreds of hours doing, was like deconstructing a love sonnet by reducing it to a series of syllogisms. Yet to the residents and pediatricians who had cared for her since she was 3 months old, there was no guide to Leah's world except her chart, as each of them struggled to make sense of a set of problems that were not expressible in the language they knew. The chart simply grew longer and longer, until it contained more than 400,000 words. Every one of those words reflected its author's intelligence, training, and good intentions, but not a single one dealt with the Lees' perception of their daughter's illness. Almost every discussion of cross-cultural medicine that I had ever read quoted a set of 8 questions, designed to elicit a patient's explanatory model, which were developed by Arthur Kleinman, a psychiatrist and medical anthropologist who chairs the Department of Social Medicine at Harvard Medical School. The first few times I read these questions they seemed so obvious I hardly noticed them. Around the 50th time, I began to think that, like many obvious things, they might actually be a work of genius. I recently decided to call Kleinman to tell him how I thought the Lees might have answered his questions after Leah's earliest seizures, before any medications had been administered, resisted, or blamed, if they had had a good interpreter and had felt sufficiently at ease to tell the truth. To wit. 1. What do you call the problem? Qaug dab peg. That means the spirit catches you and you fall down. 2. What do you think has caused the problem? Soul loss. 3. Why do you think it started when it did? Leah's sister year slammed the door and Leah's soul was frightened out of her body. 4. What do you think the sickness does? How does it work? It makes Leah shake and fall down. It works because a spirit called a dab is catching her. 5. How severe is the sickness? Will it have a short or long course? Why are you asking us those questions? If you are a good doctor, you should know the answers yourself. 6. What kind of treatment do you think the patient should receive? What are the most important results you hope she receives from this treatment? You should give Leah medicine to take for a week but no longer. After she is well, she should stop taking the medicine. You should not treat her by taking her blood or the fluid from her backbone. Leah should also be treated at home with our Hmong medicines and by sacrificing pigs and chickens. We hope Leah will be healthy, but we are not sure we want her to stop shaking forever because it makes her noble in our culture. And when she grows up she might become a shaman. 7. What are the chief problems the sickness has caused? It has made us sad to see Leah hurt. And it has made us angry at your. 8. What do you fear most about the sickness? That Leah's soul will never return. I thought Kleinman would consider these responses so bizarre that he would be at a loss for words. When I had presented this same material, more or less, to Neil and Peggy, they had said, Mr. and Mrs. Lee thought what? But after each answer, he said, with great enthusiasm, right. Nothing surprised him. Everything delighted him. From his vantage point, a physician could encounter no more captivating a patient than Leah, no finer a set of parents than the Lees. Then I told him what had happened later, the Lees' non-compliance with Leah's anticonvulsant regimen, the foster home, the neurological catastrophe, and asked him if he had any retroactive suggestions for her pediatricians. I have 3, he said briskly. First, get rid of the term compliance. It's a lousy term. It implies moral hegemony. You don't want a command from a general. You want a colloquy. Second, instead of looking at a model of coercion, look at a model of mediation. Go find a member of the Hmong community. Or go find a medical anthropologist who can help you negotiate. Remember that a stance of mediation, like a divorce proceeding, requires compromise on both sides. Decide what's critical and be willing to compromise on everything else. Third, you need to understand that as powerful an influence as the culture of the Hmong patient and her family is on this case, the culture of biomedicine is equally powerful. If you can't see that your own culture has its own set of interests, emotions, and biases, how can you expect to deal successfully with someone else's culture?